Now, ladies and gentlemen, here's your host, author, innovator, and corporate strategist, Dr. Nicholas J. Webb.
Hi, this is Nicholas Webb, and thank you so much for the great response I received from my keynote presentation at the recent Health Dimensions event in beautiful San Diego, California. You know, I had so many people come up to me after the event that I thought it might not be a bad idea to do a really quick podcast, maybe about 5 or 10 minutes long, just to leave you with a few more tips that perhaps you could incorporate into your business that could really have a meaningful impact in the way in which you drive efficiency and profit, and the way in which you attract employees, and the way in which you, of course, drive super high levels of patient satisfaction. So here's my recommendations. You know, first of all, it's interesting that businesses will put a lot of time and effort into budgets because they want to manage the finite aspects that is money, right? So we create formal strategies around money in the form of expense budgets, in the form of revenue and projections, and the list goes on, right? We build full financial suites around strategies to manage money. We do the same thing with virtually every single aspect of our business, but yet we tend not to do it in the areas of innovation and in the areas of customer or patient experience. And I think that's a really big mistake because my research shows, and it's pretty clear, that organizations that have developed formal experience strategies, that is, strategies that are designed to really, truly formally organize the types of resources that are necessary to drive patient experience design and to drive innovation in their businesses, those businesses do really, really well. And they do well on so many different levels. In fact, there's studies that show that organizations that are leveraging formal innovation best practices are enjoying as much as 60% better returns across all of their enterprise strategies. And we know for a fact that we are in a time of hyper-consumerization. And that hyper-consumerization is driven in a time of digital ubiquity where hyper-influential social networks are determining who likes us and who doesn't. So I think my first piece of advice is to build a formal patient experience strategy. It's not hard to do, doesn't take a lot of time, but it has an incredible impact. Remember that we want to design beautiful experiences across the 5 touch points of the patient. That pre-touch moment where they're researching us, the first touch moment, which has an 80% impact on the way in which they're going to feel about us forever. Then there's the core experience. And then, of course, there's the last touch moment and then the in-touch moment. To get an outline of these, you can download them at whatcustomerscrave.com. Simply go to the homepage and scroll down to the bottom. Enter in a couple pieces of information. I never email anybody, so don't worry about that. And you can download the first chapter of the book, and it kind of outlines these principles. So we want to create a customer experience strategy or a patient experience strategy. We want to be able to learn how to identify the personas. You know, we don't sell to customers. We sell to a range of customers. You have hospital customers. You have physician customers. You have stakeholder customers. And, of course, you certainly have patient customers. So understanding who they are, inventing better experiences across those 5 touch points in both digital and non-digital environments is critical. When you take a look at the 4 major disruptors of the future of healthcare, disruptive innovation, consumerization, connection architecture, and new economic models, the one advantage that you have today, it's something you have total control over, and that is your ability to own the patient and the customer relationship. Nobody can destroy you when you own these special relationships. In fact, we know that organizations are losing as much as 30% of revenue and patient growth just by not having formal patient experience design. So certainly the best organizations are future ready. They're building future ready strategies that incorporate all aspects of operational efficiency. But I think right now, my biggest advice would be to look at your patient experience strategies and really build something that's formal. Conduct a hackathon with your patient-facing stakeholders and go across those 5 touch points to identify ways to really make this special. In my book, What Customers Crave, I kind of outlined a template that you can use that really kind of creates these plans. But, you know, no matter what methodology you use, I would say that, you know, as the old, probably worn out saying would suggest, that failing to plan is planning to fail. It's certainly the case where we are right now in this environment. it is a very, very big lost opportunity for us not to formalize these strategies. Again, I met some amazing people. I learned so much from so many of you. I appreciate your kindness and your reception to myself and my family. So thanks again, everybody. I really enjoyed getting a chance to meet you at the Health Dimensions meeting in beautiful San Diego. Thank you. Bye-bye.